If your child has been fitted with a bone conduction hearing aid on a soft band for the first time, you will have been provided with some accessories to help you use and take care of the bone conduction hearing aid. In this video, I will go over the accessories provided with the Cochlear Baha at Manchester Royal Infirmary. To attach the Baha to the soft band, clip it onto the hard, circular disc. It will attach like a press stud. To put the Baha on your child, lift it up and over their head, and make sure the Baha is in the correct position behind their ear. If your child has longer hair, you may wish to clip the Baha around their neck first, and then bring it up into position. The Baha should not be positioned on top of the ear. It should sit on the bony part, just behind the ear. Make sure it is not touching the ear. Also avoid having the Baha sitting on top of hair, as this can affect how well the sound is transmitted. You can position the Baha on the forehead. You may wish to do this if your child is lying down or in a pram. The Baha can sit anywhere on the bony part of the forehead. Make sure it is not sitting on the temple. The soft band should be quite tight on the head, so you are able to fit only 1 or 2 fingers underneath. We recommend using the safety line, which will prevent the hearing aid from being lost if it comes off your child's head. To attach the safety line to the Baha, feed the black line through the hole in the Baha just here. Thread the black line through the loop at the end of the safety line, and then push the black line back through the same hole. This will allow you to pull the safety line through the hole. Then thread the clip of the safety line through the loop and pull it tight. To use the safety line, clip it to the back of your child's collar. To listen to your child's Baha yourself, you can use the listening bar. Attach the listening bar to the Baha like a press stud, and then grip it between your first and second fingers. Using both hands, block your ears with your third finger, and press the listening bar to the bony part behind your ear. A soft pad will be attached to the back of the black disc to make it more comfortable. You will need to change this every few weeks or months, as required when the soft pad is squished flat. To attach a new soft pad, remove the sticker from one side of the new soft pad and attach it to the black disc. Then remove the stickers from the other side of the soft pad.